When you come into the OR, we try to approach you from the perspective of if you were a family member, how would we want you to be treated? And so one of the first things that we do is we greet you and introduce ourselves. You're walking into a very clinical, controlled environment, so it has a tendency to feel cold and sterile, so we try to compensate for that as much as we can. So once I, as a circulator, have greeted you, I will begin the safety measures right away. I will ask you what your name is. I will check your armband. I'll ask you what the procedure is that you're having done. I will ask you who the surgeon is that's going to be performing it. I will ask you if there are any allergies that you have and any questions that you have. And once we've completed that, then I will lay you on the bed. I will continue with comfort measures and safety measures. I'll put a warm blanket on you. I'll put pillows under your knees if you need them. Anything to make you comfortable. If you need the head of the bed up because you have difficulty breathing, I will do that. We are constantly thinking about the safety and comfort of our patients. At this point, you will probably have received some anesthesia, whether it's general anesthesia or just some sedation. And once that happens, everybody in the room on the surgical team becomes the eyes and ears of the patient. We want to ensure that no harm is done to you, that your skin remains in good condition, that when we position you for your procedure, that you're anatomically correct, so that when you wake up or the next day you don't have any kind of complications regarding that. Once we have positioned you and I've prepped your skin and the surgeon has come in, before anything else happens, we do what is called a timeout. And during this time, everyone in the room is quiet and attentive. And what I do is I will open up your chart and I will state your name, what the procedure is that you're having done, who the surgeon is, and which side you're having it done. And anesthesia will add to that by saying if you've had any kind of antibiotic. It's not until that timeout is finished and everybody is in agreement that we begin the surgical procedure. Now, during the course of the procedure, I will try to call out to family if it's applicable and let the family know how the procedure is progressing. And once the surgery is finished and we have your dressings on, we will transfer you onto a cart. And again, keeping you warm and comfortable, and we'll transfer you to post-anesthesia care unit where we will hand you over to one of the nurses there and they will continue with your care.